Take magnesium at night. You've heard that, right? Well, after 60, that one-size-fits-all advice can backfire. Common heart, blood pressure, and heartburn medications can clash with magnesium in ways that put stress on your heart and kidneys. In the next few minutes, I'll show you the senior-safe way, who should take it, who shouldn't, and how to use it wisely. You know, magnesium gets talked about like it's a magic fix for everything. Better sleep, fewer cramps, calmer nerves. And yes, it can help with all of that. But here's what most people don't realize, especially after 60. Your body changes, your medications change, and the way magnesium works inside you changes too. A lot of folks start taking it because a friend swears by it, or they read that everyone's deficient. But the truth is, some people really benefit from magnesium, and others could actually be putting themselves at risk without knowing it. In this video, we're going to clear all that up. You'll learn exactly who should take magnesium, who shouldn't, and how to use it safely alongside your medications. We'll talk about the signs your body might be low in magnesium, the forms that actually absorb well, and the right doses to aim for without upsetting your stomach or lowering your blood pressure too much. By the end, you'll know how to get the benefits of magnesium while avoiding the mistakes that cause trouble for so many older adults. Before we even talk about which magnesium to buy, let's take a step back and ask an important question. Do you really need to be taking it at all? You've probably seen headlines claiming that almost everyone is magnesium deficient, but that's not quite true. The latest research shows that about half of adults don't get enough magnesium from food, but that doesn't always mean they're truly deficient. Your body is pretty good at keeping magnesium levels steady, even if your diet isn't perfect. That said, for many older adults, magnesium levels can slowly dip over time, not because you're doing something wrong, but because of how aging affects your body. As we get older, our stomach produces less acid, and that makes it harder to pull magnesium out of food we eat. Add in a few common medications like diuretics or acid blockers, and your body can start losing magnesium faster than it can replace it. So, how do you know if you might actually need a supplement? Pay attention to a few warning signs. If your muscles cramp at night, your eyelids twitch, or your hands and feet feel tingly, those can be clues your magnesium might be running low. If you often feel tired, anxious, or have trouble sleeping, that can sometimes be linked to low magnesium too. Though, of course, those symptoms can have many causes. It's also important to look at your diet. Magnesium is found in foods like nuts, beans, whole grains, dark leafy greens, and even dark chocolate. If most of your meals are from packages, or if your appetite isn't what it used to be, chances are you're not getting enough from food alone. So before reaching for a supplement, it's worth seeing how you can boost magnesium naturally with food first. And if you're still noticing those symptoms or you're taking medications that can lower magnesium, that's when a small supplement might make sense, as long as it's done safely. Now that you know when a supplement might actually be needed, let's talk about something even more important. How much magnesium is safe to take after 60, and why more isn't always better. Let's talk about how much magnesium you actually need, because this is where a lot of people get it wrong. Most adults need somewhere between 300 and 400 milligrams of magnesium a day from all sources. Now, that includes both food and supplements. But here's the key part. The upper safe limit for supplements alone is about 350 milligrams a day. That means if you're already getting some magnesium from your meals, you don't want to pile too much on top with pills or powders. For most people over 55, a supplement of around 100 to 200 milligrams a day is plenty. That's usually enough to fill in the gaps from your diet without overwhelming your system. And it's always best to start low, maybe 100 milligrams with dinner, and see how your body reacts before increasing. Taking too much magnesium at once can upset your stomach or send you running to the bathroom. That's because magnesium pulls water into your intestines, which is great if you're constipated, but not so great if you weren't expecting it. Large doses can also lower your blood pressure more than you'd like, especially if you're already taking medications for that. So think of it like tuning a radio. You're looking for that sweet spot, not blasting the volume. A small daily dose, taken with food, is usually more effective and much easier on your body than a big dose all at once. And one more important thing, magnesium from food doesn't count toward that supplement limit. So don't worry about eating leafy greens or nuts. That's all safe and beneficial. It's the pills and powders you want to keep an eye on. Next, let's make sure that when you do take magnesium, you're getting the kind that actually works. Because not all magnesium supplements are created equal, and some of them barely get absorbed at all. Now, here's where a lot of confusion starts. Not all magnesium supplements work the same way. You might look at a bottle and think, magnesium is magnesium, but your body doesn't see it that way. The type or form you choose makes a big difference in how well it's absorbed and how your stomach handles it. Let's start with the ones that tend to work best, especially for older adults. Magnesium glycinate and magnesium citrate are two of the most gentle and effective forms. Glycinate is known for being easy on digestion and can also help you relax or sleep better at night. Citrate absorbs well too, and it's often used for people who deal with mild constipation, since it can help keep things moving without being harsh. Another good option is magnesium malate, which can be a nice choice if you often feel tired or achy. It helps your muscles produce energy more efficiently, and many people find it feels a bit smoother on the stomach than other types. Now, on the flip side, magnesium oxide is the one you'll see most often in cheaper supplements, but it's also the least absorbed. Your body only takes in a small portion of it, and the rest tend to stay in your gut, which is why it works more like a laxative than a nutrient. If your goal is to relieve constipation, that can be fine short term. But if you're trying to raise your magnesium levels, it's not your best choice. Magnesium oxide isn't bad, it just behaves differently. It's poorly absorbed as a nutrient, but can be useful when the goal is short-term constipation relief. If you're trying to raise your magnesium level, glycinate, citrate, or malate are usually better fits. When it comes to taking magnesium, timing matters too. Always take it with food, preferably with your largest meal of the day. That helps your body absorb it better and prevents stomach upset. And if you need more than 100 or 200 milligrams, split your dose into two smaller amounts, one in the morning, one in the evening, instead of taking all at once. The right form can make all the difference between getting real results and wasting your money. So now that you know which types to look for, let's talk about something even more important: how magnesium can interact with common medications and what you need to do to stay safe. All right, this part is really important, especially if you take prescription medications. Magnesium might be natural, but it's still active in your body, and that means it can sometimes clash with the medicines you rely on. The good news is, with a little timing and awareness, you can avoid most of these problems easily. Let's start with one of the most common ones: acid-reducing medications, like omeprazole or pantoprazole. If you use acid-reducing medicines like omeprazole or pantoprazole, here's a nuance. Long-term use, usually a year or more, can lead to low magnesium by reducing absorption in the intestines. It's not common, but it does happen. If you've been on a PPI for a while and have cramps, fatigue, or palpitations, ask your doctor about checking magnesium and whether a supplement makes sense for you. Next, let's talk about water pills or diuretics. If you take one for high blood pressure or heart problems, it can make you lose magnesium faster through your urine. That means you might benefit from a supplement, but also means you'll want to start on the lower end of the dose range and keep your doctor in the loop. Then there are antibiotics, specifically types like tetracycline and ciprofloxacin. Magnesium can bind to these drugs in your stomach, blocking them from being absorbed. To prevent that, always separate magnesium and antibiotics by at least 2 hours before or 4 to 6 hours after. That small change makes a big difference. If you take iron or zinc, don't take them at the same time as magnesium. They can compete for absorption. An easy rule is magnesium with dinner, and iron or zinc with breakfast, or vice versa. The same rule applies to certain bone-strengthening medications, like alendronate. Magnesium can interfere with how those are absorbed too, so give them a 2-hour gap as well. If you're on digoxin or medicines at slow heart rate, the goal is balance. Low magnesium actually makes digoxin side effects more likely, so you don't want to be low, but you also don't want to add a big supplement without guidance. In this case, talk with your cardiology or pharmacy team so your dose lands in the safe, steady zone. One more tip that applies to almost everyone: don't take magnesium at the exact same time as your morning medication routine. Many people find it works best taken later in the day, with dinner. That spacing naturally reduces the chances of any unwanted interactions. So remember, magnesium isn't off limits if you're on medication. You just need to use smart timing and the right dose. Now that we've covered that, let's go over an equally important topic: who shouldn't be taking magnesium supplements at all, or at least not without medical supervision. Now, let's talk about the situations where magnesium might not be safe, because for a few people, supplements can do more harm than good. The first group is anyone with kidney problems. Healthy kidneys clear extra magnesium easily, which is why dangerous magnesium levels are rare if your kidneys work well. But with chronic kidney disease, magnesium can build up. If you've been told your kidney function is reduced, don't start a supplement unless your doctor okays it. The second group is people whose blood pressure tends to run on the low side. Magnesium naturally helps relax your blood vessels, which is one reason it can lower blood pressure slightly. That's great if your pressure runs high. But if you already get dizzy when you stand up or your readings are usually under 100, adding magnesium might make that worse. In that case, it's better to correct any magnesium deficiency through food instead of supplements unless your doctor specifically says otherwise. Next, we have people with slow heart rhythms, what doctors call bradycardia or heart block. Magnesium can sometimes slow the heart rate even further, especially in higher doses or when combined with certain heart medications. If you already have a pacemaker or your doctor monitors you for a slow pulse, it's best to avoid magnesium supplements unless they're prescribed and closely watched. Also remember, magnesium deficiency can make certain irregular heart rhythms more likely. So if your heart team wants you on magnesium, that's a different situation. Follow their plan. Lastly, if you're preparing for surgery or procedures that use anesthesia, mention any magnesium supplements to your medical team. If you're scheduled for surgery, let your team know about any supplements. Magnesium can strengthen the effect of certain muscle relaxants used during anesthesia, mainly at higher or 4 doses. Regular oral doses like 100 to 200 milligrams are rarely an issue, but it's still smart to keep your team in the loop. If you're listening to this and thinking, that sounds like me, don't worry. It doesn't mean you can never take magnesium. It just means you need to do it the right way, with your doctor's guidance. They can check your kidney function, your heart rhythm, and make sure your medications are balanced before adding anything new. Up next, we'll look at a problem that confuses a lot of people, magnesium testing. Because you can have normal blood test results and still be low in magnesium where it actually matters, inside your muscles and cells. Let's break down how to really know if you're deficient. So, how can you tell if you're actually low in magnesium? This is where things can get a little tricky. Most people assume that a simple blood test will give them the answer, but that's not always true. Here's why. Only about 1% of all the magnesium in your body is found in your blood. The rest is stored inside your muscles, bones, and cells. That means your blood test can look perfectly normal, even if the rest of your body is running low. Your body works hard to keep blood levels stable. It will actually pull magnesium out of your bones and muscles to keep that balance. So the number on your lab report doesn't always tell the full story. So, if blood tests can miss it, what should you look for instead? Pay attention to how you feel. Magnesium plays a big role in how your nerves and muscles function, so early signs of low magnesium often show up in those areas. Things like muscle cramps at night, twitching eyelids, or tingling in your hands and feet can all be early clues. Other signs can be a bit more subtle, feeling tired even after a good night's sleep, struggling to fall asleep, feeling more anxious or easily startled, or noticing irregular heartbeats or palpitations. Of course, these symptoms can have many different causes, but if several of them sound familiar, magnesium might be part of the picture. One more note, these symptoms are nonspecific. Cramps, twitches, tingling, trouble sleeping, and fatigue can come from many causes. That's why we start low, go slow, and loop in your clinician if symptoms persist. Your doctor can order more specific tests if needed, like a red blood cell magnesium test, which gives a slightly better picture of your body's stores. But in most cases, if your symptoms match and you have risk factors like certain medications or a diet low in magnesium-rich foods, your doctor might recommend a small supplement trial to see if you notice improvement. The key is to start low, go slow, and always keep an open line with your healthcare provider. It's not about chasing a perfect number on a test. It's about helping your body feel and function at its best. Next, let's talk about something that affects almost everyone, the hidden habits and daily choices that quietly drain your magnesium levels without you realizing it. Now, even if you're eating well and taking care of yourself, there are a few everyday things that can quietly drain your magnesium levels over time. These aren't mistakes. They're just parts of life that most people don't realize have an effect. Let's start with one of the biggest, stress. When you're under stress, your body releases hormones like cortisol and adrenaline. These make your kidneys push out more magnesium through your urine. So the more stress you face, the faster your magnesium tank runs low. And here's the kicker. Low magnesium can actually make you feel more anxious and tense, which keeps the cycle going. That's why many people find they sleep better and feel calmer once their magnesium levels improve. Next is alcohol. Even moderate drinking, a glass of wine or a couple beers here and there, can interfere with magnesium absorption and increase how much you lose through urination. If you enjoy a drink now and then, try to balance it out by staying hydrated and getting plenty of magnesium-rich foods like leafy greens or nuts on those days. Caffeine is another sneaky one. Your morning coffee or afternoon tea can slightly raise how much magnesium your body flushes out. That doesn't mean you have to give it up, but if you drink several cups a day, it's one more reason to be mindful of keeping your magnesium intake steady. Sweating also plays a role, not just for athletes, but for anyone who walks, gardens, or spends time in warm weather. When you sweat, you lose small amounts of magnesium magnesium along with sodium and potassium. Over time, that can add up, especially during the summer months. And if you have diabetes or high blood sugar, this one's important. When blood sugar is elevated, your kidneys work overtime to clear out the extra glucose, and magnesium goes right along with it. That can leave you deficient even if your diet is pretty good. The good news is all of these drains can be managed with a few smart habits. Stay hydrated, eat magnesium-rich foods daily, keep stress under control, and talk with your doctor about adjusting your supplement if you have diabetes or take medications that increase magnesium loss. Now that you know what drains your magnesium, let's bring it all together. I'll walk you through a simple step-by-step plan to make sure you're getting magnesium safely and effectively without overdoing it. Let's put everything together into a clear, simple plan, something you can actually use starting today. Step 1 is food first. Try to include at least one magnesium-rich food with each meal. That could be a small handful of almonds or cashews, a serving of beans, some dark leafy greens like spinach, or even a square of dark chocolate. Whole grain bread or oatmeal in the morning helps too. These foods not only add magnesium, but also come with fiber, protein, and other nutrients your body needs. Step 2 is to start low if you use a supplement. Begin with 100 milligrams of magnesium glycinate or citrate, taken with your evening meal. Give your body a week to adjust and see how you feel. If your digestion is fine and your symptoms like cramps or poor sleep start to ease, you can stay at that dose or, if needed, slowly increase to 200 milligrams split between breakfast and dinner. If you take calcium, don't stack it at the exact same time as magnesium. They can compete a bit. Many people do calcium at lunch and magnesium at dinner, or the other way around. Step 3 is to respect the upper limit. Don't go beyond 350 milligrams a day from supplements unless your doctor specifically advises it. More isn't better. It just increases the risk of stomach upset or low blood pressure. Step 4 is to time it right. Keep at least 2 hours between magnesium and medications like antibiotics, acid blockers, or bone strengthening pills. If you take multiple prescriptions, it's usually safest to have magnesium with dinner instead of breakfast. Magnesium also helps your body activate vitamin D. If you're on higher dose vitamin D, keep your magnesium steady so the vitamin D can actually do its job. Step 5 is to listen to your body. If you ever feel dizzy, unusually tired, or notice a slower heartbeat, stop the supplement and talk to your healthcare provider. Those can be signs that your magnesium level is getting too high or that it's interacting with your medication. And step 6, make it part of a healthy routine. Magnesium works best when paired with good hydration, balanced meals, regular movement, and stress control. Think of it as one helpful tool in your overall wellness toolbox, not a magic fix. When you follow these steps, magnesium can support better muscle function, steadier energy, and calmer nerves, all without risking your heart or kidneys. Now, let's wrap up with the key takeaways and a quick encouragement to help you feel confident moving forward. If your kidneys are healthy, serious magnesium overload from typical supplement doses is uncommon. The key is picking the right form, spacing from your meds, and stay within that 100 to 200 milligram range unless your clinician says otherwise.